And we are going to admit all.
Oh, look at all these people.
Hello, everyone.
Hello.
Hello.
Thank you for your patience. Just tiny technical difficulties this evening.
Oh, yeah, it's going to.
Wednesday, feeling like a Monday.
Oh, well, I
right?
thought you were doing other stuff.
Hi, Joe. Hey, everyone, and welcome. We would just love for everyone to mute themselves, and we're going to get situated with Dr. Stillwell, and then we will get started in just a minute. Thanks for being here. All these familiar faces.
I know that. Give me a break.
All right, if everyone could mute, that would be wonderful.
Did you get my email with the question?
Where?
Hi, Jonathan. When did you send it?
This morning.
I thought you already did.
Let me check.
Okay.
I'm not sure that I did, but I checked my junk folder also. We'll have time for Q&A.
Good boil.
Okay, let me find. So, Dr. Stillwell, are you on? I need you to talk so you'll come to the front.
I saw you on this screen.
If you don't see in the morning or no, at night.
Hi guys, hello.
Oh, you can see everybody else.
I'm just looking for Dr. Stillwell. And Elizabeth, Elizabeth, can you talk? That will bring you to the front. Are you here?
I'm here. I'm right next to you, Laurel. Right next to you, by your side.
All right. We are letting more people in. Sorry for the delay tonight, guys.
Greg is entering the waiting room.
Yep, Dr. Stillwell is having some computer problems. If everyone could mute, that would eliminate the background noise. Thank you so much. Thanks for everyone coming on. If you could mute, that would be wonderful.
And they hear?
Thanks.
All right, we're just waiting for Dr. Stillwell. Greg, are you here, Dr. Stillwell?
Wyatt puts you as the person in. I no.
He's not.
All right, we are. Let's see. Oh goodness, technology is getting the best of us tonight. Hang on one second. Dr. Stillwell, are you here?
Hey, Laura.
Oh, there he is. Yay. Okay.
What?
That was close.
Stay right there.
All right, so we are going to get started. Let me type you in. Okay, so welcome everyone.
It took me a while to find the mute, so some people.
Okay, I'm gonna help with muting if that's okay. So thank you everyone for being here tonight. My name is Laurel Richardson. I'm the Director of Community Outreach for the CMTA, and we are thrilled to have you with us. I apologize for the delay, but technology is getting the best of us tonight, and we're doing our best to get caught up here. Happy to have you with us. Would love for everyone to mute. If a lot of you have muted already, and thank you. If you're just coming on, if you could mute your screen so we can reduce the background noise, that would be wonderful. So we can hear from Dr. Stillwell. So we are recording the meeting tonight. No one else needs to record the meeting because we're recording the meeting, and we will edit it, add subtitles, and get it added to our website. I will also share that with everyone who is registered. So I will email that out to you when it's ready. And I am going to turn it over to my co-host, Elizabeth Ouellette.
Okay, I didn't know you were going to do that, Laurel.
Surprise.
Hi, everyone. I'm Elizabeth Olet, and Laurel and I put these Zoom meetings on every month. And this month, we are thrilled to present Dr. Stilwell. He has been on the advisory board for like forever. Like, how long has it been?
Since I was 6.
Since you were 6? Yeah, that sounds about right. And he speaks Spanish. He does presentations in Spanish, and he's an advocate of walking with poles, and he's done videos. He's done so much for us. He is really a diamond in the rough. And so tonight he will talk about CMT feet. And there's a lot to talk about there, and he has a lot of knowledge. And Dr. Stillwell does have CMT himself, so he can definitely relate to your issues. So Dr. Stillwell, how would you like to do this evening?
Talk about rough, that we're going to be talking about some rough feet tonight. But you know, so we got kind of a late start, and we have a bucket load of slides that thankfully Elizabeth was able to pull up a presentation that I had given earlier, and because of some technological issues, the other one. But this will be great because it'll give us lots of information. But I want to save time because we've got a lot of good questions that we want to answer before the hour is up. And
do you want me just to pull up those slides and you tell me when to change them?
that would be fine. I'll so what's the code word for the next
So here, let me find them. I just had them on my desktop. Whoa!
As long as once they're open, then make sure they're open and then go back to share screen.
So why don't you tell them, why don't you tell everyone where you are now, Dr. Stilwell? I think you live in Florida, right? And why did you move to Florida?
September 1st, I moved to Tampa, Florida to work with the University of South Florida. We're developing an orthotic that will be just for CMT feet. Now, there's a lot of different kinds of CMT feet I'm finding out, but anyway, part of the presentation tonight was I was going to ask some of the people if we couldn't get you to either partake in some of our research studies on gait analysis and what kind of insert. This is a special kind of gel orthotic that sticks at the bottom of your foot, and so that it would be custom made for your foot to help to relieve pressure points, calluses, you know, get the weight back instead of on just one side of your foot, hopefully balance it out where it could be down more the center where it belongs. And I'll give you a discount code for that if you'd like, or what are you thinking, Elizabeth? Are we ready to start?
I am trying to find your slides.
Oh, shoot, you sent me that link for it. I mean, I could share it off my phone. Here, let's see.
Oh, I know. Okay, hold on. Let me just do this. I did send them to you. So they're on sent items, and I'm going to put them on my desktop. And they're right here. They're open now, so I should be able to share them now, right?
Yes.
Let me get back into the Zoom meeting. Look how good I am.
Thank you all for being here.
Here we go. Let me see now. So this is what, okay. Do you remember these?
I do. I think this is from Miami.
Yes, it is. And now how do I get, Laurel, do you know how I get it to be full screen?
So you want to go down to that tiny icon at the bottom that looks like a presentation mode. Oh, it looks like a tiny, almost like a podium with a screen.
The easiest way is to go click on slideshow and then run from the beginning. This is PowerPoint.
Yes.
So click on slideshow, which is up.
Okay, on the actual slides, on the slideshow. Okay.
Yes. Yeah, see what it says slideshow at the top of your header?
Okay.
Yeah, up at the top, it says slideshow. You know, it says file, home, insert, draw.
Yeah.
Yeah, click on slideshow. And then from the beginning.
Oh, good. Okay, good. From the beginning.
There you go.
Oh, whoever just said that, I love you.
Teamwork. That was
I've
Richard.
been doing Zoom stuff for years.
Thank you.
I'm going
All right, Kenny, let's take it from the top. Boom.
Okay.
Okay, Next slide, please.
Can you see it?
There we go. There is a Instagram page that if you guys are, some of the questions tonight had to do with balance and how do you walk more easily. And there's an Instagram page called Pilates Whole Walking. So hopefully you all have access to Instagram and can look that up, because there's a lot of good stuff about how to get a little more strength in your legs and how to develop balance and how to be a little more graceful. I wanted to just give you a quick background here. You guys probably all know this, but the further you are away from the central axis, like, oh boy, that's the central part of the neurological system, that the spinal cord then CMT affects you further out. And so the difficulty with balance has to do not only with the foot shape and the foot weakness, but also the accommodations that have happened higher up in the knees and the hips, the pelvis, these kind of things. So let's go to that next slide. This next slide, which isn't showing up on my screen yet, but has to do with MRIs. And what we found, this was a study we did back some years ago, actually, that has now really been helpful in various clinics in being able to evaluate what the muscles are doing in the legs, the calves, and the pelvis, because sometimes the amount of atrophy that you look at a leg, it looks like it's almost normal shape, but then you look at the inside where the muscles are. Like, see that one slide, or that the one that says C, looks like little beef steaks, and so that's the tibia, that bone in the middle there, and the fibula is on the outside there. But those are relatively normal muscles, but then you drop down to that letter D, and then you see that the tibia is there in the front now because you're further down the leg, and those muscles are gone. It's all just what we call fatty infiltration. And so this helps us to understand better about how much potential you have left for rehabilitation. How much can we train those muscles back to be strong again? And if they're already at that stage, like you see in the bottom slide D, that then it's going to be challenging.
Okay.
Next slide, please. This next slide talks about just real quick, just some future research. You've probably heard of this thing, epigenetics and neuroplasticity. I mean, the CMTA has been wonderful about finding pharmaceutical companies that'll help us to develop drugs that can hopefully cure CMT. But meanwhile, there's also this whole other side of the story where, that the nerves are actually able to repair themselves to some extent. And so if we can figure out how to slow down what the CMT is doing to your nerves, then that too could help with being able to minimize the way that it continues to atrophy your muscles. Next slide, please. Thanks for doing this, Elizabeth, by the way.
Sure.
I know this is not part of your job description.
Oh yeah, everything is.
It is.
How can a podiatrist help?
Here, I think what we want to do is to say, that there are a lot of questions tonight on things like, my toenails are growing crooked, or my hands are so weak I can't, trim my toenails, or I've gotten so stiff I can't file my calluses down anymore. And so this is where, a podiatrist can help you with these things. And, if you're on Medicare, they normally deal with Medicare, private insurance, whatever. And so it's, I'm hoping, if nothing else, that the locale that you all are located in, you will reach out, if you're not already seeing somebody that's trained in these feet and leg things, to help you stay out of trouble, because there are some issues where you could potentially wind up in deeper trouble, like in the hospital with antibiotics and those kind of things.
So may I ask a question? So podiatrists can help with nerve pain management?
Well, one of the things we were going to talk about tonight, thank you for asking, is benfotiamine, and I'm happy to spell that out for you, but it's a B vitamin basically. And, with nerve pain, like sciatica is the most common one, but there's diabetic neuropathy. There's nerve pain that those of us with CMT have. And so benfotiamine is you've probably heard of the B vitamin thiamine. So thiamine has been bonded with a fat molecule to make it more absorbable into the nerves. And so benfotiamine, benfotiamine, is available over the counter. You go to the Whole Foods or some kind of a health food store. I take 500 milligrams of benfotiamine when I'm having nerve pain. And it's amazing how fast it works. And it's not a cure, but it takes care of nerve pain for several hours, sometimes several days. And
Stillwell,
so please,
we're having some trouble hearing you. Are you as close to your microphone as you can be?
let me see if I can close this door.
So while he's doing that, Laurel, I see that benfotiamine is a vitamin B1, also called thiamine.
Yeah, so that's what I was saying. Was that thiamine, what they've done
Sabrina.
is they found that if they would bond thiamine to a fat molecule, it should be absorbed into the nerves and help quite readily with nerve pain.
So scientists are studying it to see if it might help with conditions like diabetes-related nerve damage, Alzheimer's, alcohol dependence, etc. That's very interesting. Good piece of advice there.
Yeah, so the typical dose is I'll look for a 500 milligram capsule.
Okay, how about, so a lot of people talk about hammer toes, and your next slide here is about hammer toes.
Hammer toes can occur on any of the toes. Interestingly enough, when you see the big toe have a hammer toe, that is hallmark of a neurological disease. So when you're first trying to figure out what's going on with a patient and they're presenting with some kind of a foot pain, if you see that big toe cocked up like that toe you see down there on the bottom, red flags go off that, hey, they've got some kind of a neurological disease. Oh. And so these one of the questions that had come up tonight was that the doctor wanted to do what's called a tenotomy on a toe. That said, oh, it's an in-office procedure, local anesthetic, make a small incision, and you lengthen the tendon. You see the toe that has that hammer on the end of it. If you follow that back, and you'll see the tenting of that tendon over the top of the skin there. That tendon kind of sticking out. So you lengthen that tendon to allow the toe to fall down. That's a really easy, simple procedure. It takes seconds to do, but it's really only effective if your hammer toe is reducible or flexible. So you have to catch them early before you get arthritis in the joints, because once the arthritis is in there, then you've got to do something to the bone to allow that joint to move back to a straight position.
Oh, okay.
Does that make sense?
It does.
Okay, well then let's go to the next slide.
Well, how do you prevent hammer toes? So you say before they get too arthritic.
Well, let's see here. Okay, so next slide here. One of the ways that, one of the nicest things that I feel like I do for my feet is to interlace my fingers in between the toes like that, and then you take and you move your ankle around in a circle, and just feel how the muscles pull differently as you get around different parts of that circle, go in both directions, and that loosens up a lot of the restrictions of the tendons. There's also, let's see, does this slide deck have the correct toes? Yes, it does. So there's also a thing called correct toes that are a little polypropylene toe divider that helps.
Like those yoga toes? Yeah, yeah.
The thing I don't like about yoga toes is you really can't wear them with shoes. And so I'm looking for something I can wear in my shoes that I can wear every day that will help my toes to stay straighter. So that, with, like we saw in those MRI projections earlier, that the, the muscles aren't so should be. So I've got to use like a little external splint on these toes to help keep them straight. And plus, then by keeping the toe straight, it seems to help you walk better as well. And so I'm all about trying to start at the front and keeping the toes straight so that the rest of the foot follows suit.
So have you found something to wear in your shoes that keep your toes spread apart?
Yeah, go to this next slide, please.
Okay. Oh. You have something called buttress pads there and toe socks.
Okay, yeah, for some reason it's showing up on my end, but the next slide is the buttress pad is just simply a thing to keep pressure off the tip of the toes. Oh yeah, there it is. And then the toe socks are nice to keep. Those are especially nice if you have any problems with athlete's foot between your toes, that kind of stuff. And plus, they just feel good to have the toes all spread apart. That even if they're trying to go wonko in different directions. On the next. If you bring that up, please.
It's up, you just can't see it yet.
Oh, okay. So that one, there's a patented toe spreader called.
We may have lost him. Dr. Stillwell, are you there? Sorry, everyone. Thank you for your patience. Dr. Stillwell's having connectivity issues and bandwidth issues. So we will see if we can get him back. Elizabeth?
Yeah, well, to prevent, I guess these now I don't know if you can wear these in your shoes, but these are called correct toes, silicone toe straighteners. I don't know if anybody has ever used a device like this. You want to just use your hand signal, and if you have, I know that some people are very sensitive in their feet, and like when Bethany Malash used to talk about finger stretching and stretching the wrists, and I can imagine that stretching your toes and taking care of your toes and stretching them a lot probably helps in the long run. Does anybody have that testimonial about doing that, or do you even do that? Somebody want to share their experience?
Yeah, if you've used the correct toes or something similar, feel free to unmute and share.
I remember buying those for Yo, and he's like, no way. And then I remember having him use the toe socks, and he's like, I can't even get my toes in, because at that point they were pretty deformed. And when Dr. Stillwell talked about those toes, that pinky toe of his got really, really high up, and the bone was displaced. So there's no way that could have been, well, it did get fixed, but it was much more than just a small snip of that tendon. It was much, much more.
Diane put in the chat that her son used them and loves them.
Oh, see, it does. I use the yoga toes, but you're not supposed to walk in those. So we'll have to look up those toe straighteners, because I can imagine it's a constant stretch on your toes. So
he gets a bigger size shoe so he can fit them in.
Oh, wow.
And he thinks they work. So he's only 27 and his feet aren't as deformed. I've already been through surgery for mine, so I don't need a straightener, but he's hoping to be able to not need surgery because he's going this route.
So Diane, he uses these correct toes in the shoes?
He just gets a wider shoe so he can fit them inside. He wears them every day.
Wow, that's amazing. I didn't even know that that was possible. That's great. And I imagine, when I was using the yoga toes, they said start with 15 minutes, start with 20 minutes, and work up so you're not doing too much stretching. So probably, the more rigid your toes are in your
I tried the yoga toes, and maybe it's just that before I had my foot surgeries, I tried the yoga toes, and maybe my toes were too far gone. but I didn't find them helpful.
Yep.
But maybe my son just got it when, kind of on the brink before it was too late versus I tried it when I was beyond the point of no return.
Right, yeah, I do think there's something about youth and before they get too rigid, like Dr.
Yeah.
Stilwell said.
Yeah, and what you were talking about stretching, after my foot surgeries, Dr. Pfeffer said to straighten them. So like if this is my foot, he said every night you should straighten your toes by pulling them back like that, each toe at a time. But he said that will help prevent them from curling up. So I would imagine you can do the same thing with your hands. So I started doing that with my hands.
I think that's excellent because after surgery, a lot of people have, since CMT is a neurodegenerative disease, people's toes may or may not go back to where they were because your tendons keep, pulling. But that's the stretching, even after you have surgery, is never a bad thing because the muscles and the nerves no longer communicate. So the muscles just want to contract, right? So that must be very helpful. And Dr. Stillwell, I saw that he was back.
Yes, I thought so too. Dr. Stillwell, are you here?
Well, we're just going to keep going on with the presentation. I feel like as people with CMT, we kind of know what happens. I don't know how many people have calluses and black toes because of, he's in the waiting room, because of continuing hitting your feet on the edge of your shoes. Now, do people buy wider shoes so this doesn't happen?
I've gone up a whole size and a half.
Yeah. And so it creates pressure points, and I know it can, and calluses, I don't have CMT, but my son does. And I had my first callus and man, that hurt. It doesn't look like it hurt, it's just a bunch of skin, but it does hurt. And you can really get sores and things like that. So pressure points are not good. And the other thing that Dr. Pfeffer told us was, so does anyone here have, I'm sure you do, he says, check your feet every single day because CMT also causes a loss of sensation. So there could be something going on, you don't even know it. So he uses that long mirror and looks at the bottom of his feet, probably not every night, but once in a while to make sure he doesn't have something going on. Does anybody else know what I'm talking about?
Yeah.
A long mirror, yeah.
Yeah, Dr. Pfeffer told me the same thing. He said, actually, I think he said, use it as an excuse to go get pedicures on a regular basis. Make sure someone's looking at your feet.
There you go. Good. So that's an essential tool if you have CMT.
Yeah.
And so
I think Dr. Stillwell might be here. Dr. Stillwell, can you hear us?
Hi, Laurel, can you hear me?
Yay! Yes, we can hear you. I would just, if you could be as close to your microphone and speak loudly, that would be wonderful.
So now we're talking about the treatment of, we've gone through a couple slides. We're going through the treatment of hammer toes. And you have some silicone caps on these toes, and I'm not sure what that's for.
So when you have arthritis in the joints, the bone needs to be realigned to allow the joints to get back straight again. And so usually then some type of a pin fixation, something is used to hold the bones in correct alignment until they heal. And so what's happening there is that there are what's called K-wires, the little smooth pins that are in there that we leave sticking out of the end of the toes so that they can be removed easily once the healing is complete. And so the silicone top is just
Yeah, so it's a protector for the toes. Huh.
Sorry to interrupt.
protector.
Someone suggested if we turn our cameras off, it might help with Dr. Stillwell's bandwidth, but I think he's called in on his cell phone now, so I'm not sure that would still help.
So, Dr. Stilwell, can you hear us?
I mean, I can hear you, yes.
Okay, well, we can hear you too, because someone said Yeah, they had a foot ulcer, and I know Johan did too, that he didn't even know about it. And it took like a year to heal. So those are really hard to heal once you go into the full ulcer kind of mode, right? So now you were saying
Yeah,
about
this
this.
is one of the,
Go ahead.
well, this is one of the reasons that we recommend that we keep the calluses trimmed down on a regular basis, the corns, you know, especially if you have crooked toes, you're bearing weight on the outside of your foot, these kind of things. So those pressure points develop thickenings in the skin, calluses, corns, these kind of things that will continue to build up because the pressure is still there every time you step down on it. And so initially that callus is a protective layer that's beneficial, but then as it continues to build up because of you continue to walk on that one spot, then it will act like a rock in your shoe and actually create an ulceration.
So I'd like to ask you a question. So those silicone sleeves, you know, if people don't have feeling in their foot, there's somebody that said that they put those on and the toe, the circulation was cut off and the toe turned black. So I imagine the sleeve was too small. And so what is the fitting guide for those? How do you fit those hammer toe silicone sleeves?
Oh, there we go. Yeah, like I see what you're talking about. Yeah, those are things you can buy just at the drugstore that help to slightly realign the toe and also help to prevent pressure areas.
How do you fit them so they're not going to cause you more problems and cut off circulation?
Well, you know, typically what you do is that you take the base of them, you know, that they're round at the base, they're take and cut a little, just cut them at a diagonal so that the bottom is more open than the top so that they will lay on your toe correctly.
Oh,
The
okay.
thing I don't like about these silicone sleeves is they hold a lot of moisture in there, so that they're really not meant to be worn for more than several hours at a time because they don't breathe. And, if you have a certain pair of shoes that you know that you're going to a wedding or something and you got to wear shoes, but it hurts that third toe, that then you wear that sleeve to help keep the pressure off. But then it's really not meant to be worn all day.
I see. So that was probably part of the problem, is 1 or 2 hours a day or something like that. Okay.
This picture down here where it shows the foot from the bottom and the orthotic has been cut out and there's that blue layer in there. You know, what they're doing there is that they're trying to float that area of pressure over the edge of the thicker brown material behind it. So it kind of falls down into that pocket to hopefully reduce some of that pressure. And so these are the kind of things you can do yourselves at home. You know, you buy a couple of gel insoles from Walgreens or Walmart somewhere, and you can cut a hole like this in one of them and then set the other one on top of it. So you still have some cushion, but you also have what's called accommodation to help relieve some of the pressure on that area.
Okay, let's go to the next slide. Thank you. So now we're on the surgical treatment of hammer toes.
So this is not to belabor this too much, but just that there are basically two main types of hammer toe surgery. One for the flexible toe, which is easier and quicker. That's like what they're doing there on the left, where just to release the tight tendon. And then the one on the right is more common with Charcot-Marie-Tooth because, you know, most of us wait to have anything done with our toes until it's pretty bad. Then at that point, it's arthritic and fixed in one position. And so you need something a little more elaborate to get that toe down straight again. And so usually requires some bony work.
And then there's also the removal. I am on to the next slide now, and they're talking about arthroplasty. So to remove a part of the bone, I didn't know people did this.
Yeah, so you can take it out of the joint like that, for example. That's commonly done with neurological diseases because the idea of thinking that the muscle imbalance is going to continue to try to pull that toe crooked. So you basically cut that little joint out, and pin it straight, and then it heals straight. And then that way that there's no more
Okay, well, I don't know. I hadn't heard that, Laurel. Have you heard of arthroplasty and taking a piece of the bone out?
I've heard of that, but I don't think it's very common. It's certainly not something I hear about all the time. My sister had pins put in her toes, and she actually wishes she hadn't. Her hammer toes were really bad. Her toes were really crooked when she was younger. And I just remember her saying a couple of years ago, she wished she hadn't put the pins, but I've heard from a lot of people how successful that has been for them.
Like they kept the pins in there?
Mm-hmm.
Oh,
Yeah.
wow.
So Dr. Pfeffer kept the screw in my big toe, but took the pins out of the 4 little toes.
You're right.
So he fused it and I guess glued it with like cadaver bone, and then had these like push pins in the 4 little toes, and a screw is left in the big toe. I'm very happy.
Yeah.
So much easier to get your foot into a shoe when your toes are straight.
Oh my gosh, I know, right? Oh, okay.
Yeah, sometimes the pins are removed. Other times, like myself, I've got pins in several of my toes. Where my brother, who has the same condition, he had pins put in, and then once the toe was straightened out, then they removed the pins.
So yeah, so I guess there are a couple different things with the pins, and then some of them are, Dr. Silva, I saw that you just came back, and I'd like to know the difference between these implants and, the fusion. I can't even see what the other thing is, but when you leave the pins in and when you don't, it must be 2 different kind of surgical procedures. Because I know Johan had his toes fused. What is the other? Go ahead.
I was going to see if Dr. Stillwell was there, if he made it back. Go ahead, Lisa.
Sorry.
No, go ahead. Thank you.
I thought arthroplasty was fusing the toes, but is that not the case? Because I thought that's what I thought I had. But I could be confused. And I also, I didn't have Dr. Pfeffer, but I had my big toes. I have a screw permanently in them. And then same as the other woman just spoke, I had pins that hung out of the toes for 6 weeks while the bone was fusing and around the pins. And then after 6 or 8 weeks, they removed those pins.
Well, I think arthroplasty, isn't that when you either use like an artificial joint or they restore or they resurface the bone?
Hi, am I back on the meeting?
Yes, maybe you can shed some light on this discussion.
Oh my gosh. So arthroplasty, plasty is the term for repair. So arthrodesis is fusion, desis is really, but then arthroplasty would be just where you realign the joint. And so it depends on how severe the hammer toe is. If you've had pins in there for 6 weeks, they were probably fusing the joints. That's why it took so many weeks.
Yeah, that's probably the case then. Yeah.
But that's, commonly done, like I said, for the progressive neurological disease, because you don't want to have to worry about it causing issues with you several years later.
Right. So, Dr. Stilwell, let's talk about arch problems in people with CMT. Most people with CMT have high arches, and some people have very flat feet, and I don't think we really understand why that is. Is that true?
I think, true. I don't know, there's been any really good research done on that. It seems to have to do with the pattern of demyelination and which muscles atrophy first. And so therefore, does the arch collapse or does the arch get high and rigid? But anyway, yeah, go ahead.
I'll go to the next slide. Go ahead. So having high arches, and what does that do to a CMT foot?
So there's that hammer toe or the big toe I was telling you about. That's classic for someone that has a neurological disease. And, so what it does is when the big toe rides up on top of that first metatarsal bone in the arch, it pushes the end of the metatarsal bone down to the bottom. And so typically you get a callus on the bottom of your foot there. And so not only is the foot rigid and not shock absorbent, but now you've got these pressure points where the foot can be quite tender because there's not a pliable, elastic surface on which to bear weight.
Right. So now let's talk about the high arches, because high arches is like when, you have a lot of pressure on the heel and the ball of the foot. And yeah.
So typically that's where we try to fill in some of the areas that, would normally be bearing weight in a flatter type foot with some type of an insert, padding, these kind of things to help to redistribute the weight around. And that's something too that is kind of a craft industry where I try to encourage people with CMT to do that themselves. Go to the drugstore, buy some different padding materials, and you can play around with creating little what's called horseshoe pads, little places like that that you can make so that the sore spot sticks down in the pocket.
Right. And let's talk about flat feet now. So what's the problem with, I'm always like, why have I got arches, but what's the problem with flat feet?
Well, here with CMT, you kind of have the double whammy. You have that torsion of the flat feet, that when the arch collapses that much, it pulls on your leg and your knee. And so you begin to get calf pain and knee pain and even up into your hip sometimes because of the way that everything's rotating inward. And then the double whammy is that most people that have that also have foot drop. And so that not only are their feet flat attack, but then they have trouble lifting the toes up. So it's, as opposed to the high arch foot that's very rigid, you have this almost like a paddle of a seal or something like that you're trying to move down the path there. And it can be very challenging without some type of AFO to wear and things to help to support that.
Yeah, I can understand that. Huh. And so you need different orthotics then for high arches, and then so flat feet are called what? Pes planus? Is that it? And
planus. Planus because it's like a plane on the bottom of the foot, and cavus because it's like you could drive a truck under there. That there's a cave that's underneath the arch.
Yeah, I like that. But it's true. I mean, and it's hard to find over-the-counter arch supports for people with CMT because the arches are really high. You probably have to have them made at a professional, right? With a podiatrist or.
Well, it depends. What high arches need is padding and cushion. More than necessarily filling in every little void, because what causes a lot of the pain with people that have high arch feet is that it's like walking on a block of wood. There's no recoil, that there's no shock absorption. And so if we can start to introduce some kind of elasticity, whether it be with a softer orthotic, whether it be with a running shoe like a Hoka running shoe that has a big thick sole, socks that have a lot of cushion, these things all help to reduce the impact that you feel when you walk with a high arch foot.
Right. And how about the flat feet? What kind of orthotics do you want there?
There is typically something a little more rigid to, that these can oftentimes be built in to your AFOs, something that will go ahead and help to hold the ankle in position. The dotted lines on the back there show how, getting the right amount of correction, tilting the foot over can help to realign that ankle again. That, when you roll to the outside like you do in a high arch foot, it's very difficult to get it aligned straight up again. But with a flat foot, you actually stand a reasonable chance of getting it to line again.
Okay. So let's talk about shoes. I mean, people are always asking us about what kind of shoes to wear when you have CMT, and you mentioned the Hoka. Because
Yeah, you know,
extra depth. Go ahead.
well, the running shoes like the Hoka, for example, they kind of serve a couple of purposes. One is they have a lot of shock absorption. That big, thick sole feels very nice underfoot. And then the other is that you can see the way that the sole at the toe is very ground off, so it comes to a point. So if you're having some issues with foot drop, with tripping, these kind of things, then these are nicer shoes because they're less likely to catch on a sidewalk that's offset or a curb or something like that. And so you're less likely to be embarrassed and trip, you know, when your foot drop catches.
Mm-hmm. And also, if you've lost some height because you're older, it'll give you that height back, because those look like they have make you 1 inch higher at least. Right? Don't they make you
Good point.
taller?
Oh, yeah. Right?
Okay.
The other thing is typically what you wind up doing is that they come with a removable insole that you can take out. So if you're wearing an AFO, then you hopefully have enough room for that foot plate of the AFO, and then some kind of insole on top of that. And
okay. So and then in the next slide, you talk about athletic shoes, but I don't really like these. I don't think I'd wear these. And are there any athletic shoes that are cooler than these shoes here?
Well, that's why I went with the Hokas first. But you know, these ones with the Velcro straps are good if you can't tie your shoes. You know, there's a lot of people that handle it so weak that really that about, you know, what they prefer is to have a couple of Velcro straps that they can just put on and be done. And so looks be darned. But certainly, you know, these are shoes that you can buy inexpensively at the discount shoe stores and can still serve a decent purpose.
How about the Billy footwear where there's a zipper and you can zip in your foot? Have you seen those?
Right. You know, that again, that those things are a little more pricey, but they, you know, Nike has come out with the one where you don't even need to pull them on, because they break in the middle. You stick your toe in and step down on them and they come around your heel.
Oh,
but again, they're $250 a pair.
Yeah, that's true. All right, well, at least there are options out there. And these are,
you know,
go ahead.
The many times these podiatrists will have a therapeutic shoe program. A lot of offices, clinics will have, you know, because these are specialized shoes that you wouldn't necessarily find at Famous Footwear, something like that. And so again, you know, another push to get you to see your local podiatrist, because I think they can help direct you where to find a shoe. I mean, again, I don't think anybody's going to try to tell you that this black shoe with a single Velcro strap over it is, you know, highly attractive, but it's highly functional.
Yeah, at some point, and I know I was just joking because I wear, you know, big, huge Saucony. I wear just huge shoes, and they're just very loud. And you know, you just have to bite. You just have to do it. You either walk or you don't walk. So you just find something that you like, kind of, and then you just deal with it, right? That's sort of what I do. But it's not easy. It's not easy sometimes. But they're coming out with more. Yeah, they're coming out with more and more shoes that are more attractive for all kinds of feet. So there's hope to find something you like.
You know, I'm having trouble telling what slide you're on, Elizabeth, but on slide 23 here, it shows the shoe that has the back of it that opens. And
that's where I am.
Oh, okay, good. That's a technology that's really helped a lot, because then you can put your brace in there, your AFO in there, and then that little dial turns and then suctions the back of the heel up against your foot so that you get nice support. But it's easy to get in and out of.
What kind of shoes are those? What is the brand?
You know, that's going to be a shoe you have to get from a prosthetist or an orthotist.
Oh.
That's a technology that they're pretty proud of, you know, price-wise. So that shoe probably would be partially covered by your insurance, hopefully, because it's that shoe's probably $500 a pair or something like that.
What are the ones in the middle?
Well, you know, that was just to show the historical shoe. That was the shoe that there may still be some of those out there. I don't know, but that was the shoe that we dealt with up until probably 1995 or something. You know, where the old leather shoe has got the metal uprights on each side. You actually have to send them to a specialized shoe place where they attach that metal brace to the outer sole. I mean, thankfully, that's really not done anymore because I don't know too many people that were happy with that. But I put that on there just because it was like, oh yeah, so it used to be that.
And on the right side, is that Gina Sweeney in a foot costume?
Yes, I'm glad you recognize that. She could
That
fit in
we're
the
getting ready
shoe.
for Halloween. That we're getting ready for Halloween here.
Okay, I went to the next slide. It says gauntlet. I don't know what that is, and boots.
Yeah, so there's it seems like there's that within the whenever I go to a CMT chapter to give a presentation, most people have carbon fiber AFOs, which are great, but depending on how unstable your ankle is, these things called gauntlets are made from a plaster mold of your foot and lower leg, and then they strap on and they hold the foot in just one position. They're lined in leather, so they breathe nicely, and they're quite supportive, but as you can see that they're a little more restrictive than, sometimes the, Allard or whatever will say, well, these things will really let you rock and move. And these things that they have you pretty well locked in. But, there's people that have had various types of ankle surgeries or who have just such severe paralysis that they need something like that so that they can walk at all.
Mm-hmm. Okay. So there's some modification. There's a modification slide, shoe gear modification with the lift, the wedge, and the rocker.
Because so many people with CMT seem to have one leg shorter than the other, we can send you somewhere to get the lift put on the shoe so that your pelvis stays level. Sometimes it's just so hard to get, like that middle picture that the wedge, you're constantly breaking down the outside of the shoe. So you put that wedge on there to tilt the whole ankle over, and then hopefully that gets you walking a little more on the flatter part of your foot.
Okay.
And then the rocker on the right, just real quick, again, to just see how the toes curled up there on the tip. So it helps to facilitate a more normal rocking heel to toe gait.
And so here's some common shoe brands and where to find them. I think, Laurel, we should include this slide for everybody. I love Zappos because I'm always getting shoes and returning them, getting them, returning them. They don't like me, but I like them.
Yes, agreed.
Yeah, and especially if you're buying the same brand of shoes over, I don't really recommend, thankfully Zappos has great return policies, but it's tough to buy shoes mail order on if you haven't actually tried them on first. But
it is.
My recommendation is to buy the first pair locally, and then you can save some money by going online and buying them through one of these other places. You just buy the same shoe because now you know what size you need and which model you like.
Okay. And know your socks. I don't know my socks.
One of the biggest issues we see with CMT feet is they're prone to fungus, to athlete's foot, to fungal nails, and I'm not quite sure why that is, but part of it is we want to try to facilitate as normal of a moisture environment around the foot as possible. So we're looking for socks that breathe, and cotton socks, for example, when they get wet, that they don't breathe and they have a tendency to hold moisture against your skin, which would certainly aggravate any fungus or athlete foot you might have. And so these, the wool, the bamboo, then now we're seeing more hemp fibers as well. But these are all hollow fibers. That picture on the left is meant to show how the moisture travels down the fibers and can wick away from your foot, because most feet perspire more than you'd ever believe. And so we've got to wick that moisture away so it doesn't cause issues.
So more than 50% cotton socks. There's some special socks that you talk about, the padded, the AFO socks.
Right, right. So again, that there is an AFO sock that's quite helpful. The compression can be really good if you're having any swelling. Typically, it's in conjunction with maybe some kind of heart disease or venous stasis, these kind of things. And so that the newer compression socks are over the counter and are quite effective.
Okay. And we talk about functional and accommodative orthotics.
So we talked about flat foot needing something that's a little more corrective. So if you have the CMT foot that's more flat, you're going to get something that's called a functional orthotic. It can actually tilt the foot into position, where if you have more of the high arch foot, that then you're going to get something softer that helps to give you shock absorption and hopefully take pressure off of any corns, calluses, and sore areas on the bottom of your feet.
Okay. I don't know how to say this word. Huzhoni. Huzhoni. How do you say that?
Well, the Hojoni has been rebranded actually since we did this, and it's now called Stand Strong. But basically, this is an arch support that sticks to the bottom of your foot. That go on to the next slide there, and you'll see that was the first iteration. That the blue ones, they've been redesigned a little bit since then, but they help to take away pressure points on the bottom of your feet, and you take them off at night, kind of like a contact lens, and wash them, and then in the morning they're sticky, and you put them back on to help your feet to walk on the correct parts.
Interesting. And those are the ones that you make, Dr. Stilwell?
Yeah, that I'll have to give you the correct web address now, since this is a little bit of an older slide. But
Sure. And how many more slides do you have here? Do you know? Because we're running out of time, so I'm wondering what we should do. What do you think, Laurel?
I'm wondering if we should jump to questions, if that's okay, Dr. Stillwell. And
I think that's great. Yeah, that's true, because I want to make sure that people get their questions answered. I mean, there's a lot of information in these slides, and we started late.
yes, and so do you have the questions I sent you? Otherwise, I can read them to you one at a time.
Well, we covered some of them. I mean, let's see. Do you want to go ahead and?
Why don't you just give him the questions and then he can answer them?
There was some that came up on the chat. I thought I saw some in the chat.
Yes, so there were some in the chat, but I'm also thinking of the people who took the time to send in their questions. So I'm going to start there. And so someone was talking about they're getting corns on their feet and they need help with that. Is the best course of action to see a podiatrist locally?
Yeah, she's saying that she'd self-treated her corn twice on her right foot over the summer. And, you know, obviously she's got a pressure point there. The toe's probably crooked, got a bone spur on it. And so she needs professional help. Yeah. Seeing, you know, someone like Glenn Pfeffer, podiatrist, you know, someone who can help her to get the pressure off of that area, because the corn is growing as a result of the pressure in the one focal area.
Okay, and then there's another question in there about someone feeling like they have a bone spur. Please make sure you're muted, everybody. Marianne, you keep coming off of mute. I'm going to go ahead and mute you because of your background noise. Thank you. So yeah, so same thing. If you're having bone spurs, if you're having reoccurring issues with your foot, you definitely need to see a professional. That would be the best course of action here.
Yeah, because usually they'll do an x-ray and they'll see how big the bone spur is, and then that helps you to identify, you know, is it so big that it's probably going to need a little surgical procedure to shave off that extra bone, or can you make some kind of a pad where it takes the pressure off that area?
Okay. And then what about with really high arches? Is it best to get a prescription for an orthotic and have something custom made? Or is there something you recommend for really high arches?
You know, what I tell people is that if they don't have access to a podiatrist, or you know, they don't have insurance, this kind of thing, you can go to you know, CVS, Walgreens, that kind of thing, and buy these gel insoles that I think Dr. Scholl's, and they have their own brand, and buy a couple of pair and put them in your shoes. And then that's where you take the second gel insole that you bought and cut holes in it and put it on top of the other one, so that bone spur, that sore spot can be dropped down in the hole. And so it typically isn't so much that you really need to fill in all the hollows of the high arch foot, but rather just take away the pressure points.
Okay, that makes sense. And if you, I'm seeing a couple comments on here, we'll get to the chat if time permits, but if you have a podiatrist who's not interested in working with you or caring about learning about CMT, I would try to find a new podiatrist for sure, because there are wonderful physicians out there who will be interested in working with you. And then someone asked about shooting toe pain, some days being worse than others. And they really like to stay active and exercise, but they're having such discomfort from the shooting toe pain. Do you have any recommendations?
You know, shooting toe pain is tough to diagnose without an examination, because it could be a pinched nerve in the ball of a foot that would respond to an orthotic. It could be something like we talked about earlier, where you need to take that benfotiamine B vitamin to help with the nerve pain, or it could be that you need an injection to help to calm down there's things called nerve entrapments, where they'll get caught in scar tissue, these kind of things that can cause shooting toe pain. So, I'm sorry, that's a little tougher one to answer. Sometimes acupuncture works really well.
Oh, that's a great idea. And then someone's asking, their balance is getting much worse, and they asked about Allard Blue rockers and bracing, and your thoughts on those.
Yeah, what happens is that balance is such a complex phenomenon, because it has not only to do with your feet, but your legs, your pelvis, and the way you use your body. And so this is why I started teaching that the balance exercises using those walking poles. And if you go to a physical therapist, for example, that they'll have you do balance exercises where you switch from one side to the other, you hang on with one hand but not the other, and these kind of things that start to train your body, because that there are muscles higher up in your legs and pelvis and your trunk that are not affected by the CMT that can certainly help with your balance. And so you can help to recruit those muscles, those stronger muscles, to make up for the weaker ones in your ankles and feet that are aggravating your loss of balance.
Mm-hmm.
Does that make sense? So this is why like Pilates is good, and these kind of things, because they help so much with balance.
Yeah, and strengthening those core and other muscles. One of the questions that we received from several people, Dr. Stillwell, is why do our feet and hands, why are they cold? Are they cold all the time? What's the cause?
This is what's called a neurogenic condition. And so what happens is, because of the nerve condition, it will a lot of times cause a reaction in your vascular, in the blood vessels. And so this is where it's helpful to use warming creams. Capsaicin is one. It's a chili pepper cream that is warming. I don't know if you ever heard of a far infrared sauna, but it's a type of sauna that it doesn't get all that warm to sit in, but it really helps to open the blood vessels and helps the nerves. And then the other is to take supplements with arginine in them. The arginine is an amino acid that helps to open blood vessels. And, we talked with one of the ladies earlier about these battery operated socks. And, there's, I noticed on Amazon the other day that there's a Snow Deer brand that it's a battery operated sock, but it has the far infrared heating in the sock. And so that, I think would probably feel very soothing. And it's abbreviated FIR for far infrared, but these are things that can help with that neurogenic coldness that we all have. And especially now as it's getting cooler this time of year.
Okay. Excellent. And someone's asking if it's safe to use a battery run callus remover themselves.
You know, I would say that the answer is probably yes. That being said, you know, my brother who has CMT had used a Dremel tool, which is a battery operated thing, right? But then that thing cut him pretty badly, like on his foot, and he couldn't really feel it. And so that the ones that are designed for shaving calluses, like you buy at the drugstore, I think those are perfectly safe.
Okay. And what about, and I'm just rolling through things quickly, if people have to go, we certainly understand, and so grateful to have you here tonight. Again, we are recording and can send it out later. What about deformed toenails that are growing sideways, toenails that have deformation? What would be a regular sort of care plan for that you might advise?
Well, either you find a salon, a pedicure salon where they do decent work and can keep that trim back for you.
Mm-hmm.
Or you can go to the podiatrist, and you know what happens is that the toes will start to shift position, and then the nail root will the nail grows from the bone, by the way. So the nail root will begin to migrate onto a different part of the bone, and so then cause the toenail to start to grow at an angle. And so that's a little office procedure where you numb up the toe and you go in and you take out part of that nail root and cauterize it so that part doesn't grow back. And either you take the whole nail off or you just take off the part that's growing crooked, depending on what it looks like. And then that's a permanent fix. So either you can just get it cut down as it grows every month or so by the beauty salon, or you can go in and get it fixed permanently by the podiatrist.
Okay. And someone wrote in and said, am I a candidate for Achilles tendon surgery since I'm 64? I have CMT 1A, had vascular surgery down my entire right leg, had an amputation of my 5th metatarsal due to osteomyelitis, have diabetes, and have had 2 heart surgeries, one of which was a quadruple bypass. The prospect of another surgery promoted by my podiatrist, orthopedist, and neurologist is not appealing to me since the benefits in recovery are not promising. Frankly, I don't see the urgency and would prefer to wait since this is by no means an emergency surgery. What are your thoughts?
You know, she talked about the amputation of part of her foot there. You know, a lot of times what happens when they start amputating like that is the Achilles tendon will get contracted and start to put way more pressure up on the ball of the foot, so you're at risk for more ulcerations up around the toes and the ball of the foot. And there's actually a thing called a percutaneous Achilles tendon lengthening you can do in a doctor's office. It's just under local anesthesia. You make tiny little incisions, 3 little nicks in the tendon, and you can get quite a bit of length that way. And you know, so it doesn't require a hospital visit. It doesn't require general anesthesia. That she would be in some type of walker boot for a while to make sure that the tendon didn't get over lengthened. But those kind of things can be a preventative procedure to help stop future ulcerations. And like she had amputations probably because she had those chronic ulcerations.
Okay. And is edema a common problem with CMT patients?
Well, certainly it is, you know, for a couple of reasons. One is because a lot of people with CMT have a tendency to do a lot of sitting. And so your feet are in a dependent position in relationship to your heart. And so that they will have a tendency to swell. You know, A, you're maybe not that active, and B, they're, you know, gravity is pulling the fluid down to the ankles. And then, of course, there's various people that maybe have some heart conditions or lymphatic venous conditions, these kind of things. And so that's where if you can lay on your back some and get your feet up on the wall, something like that, and get the feet up above your heart, then you get gravity in your favor. And then if you can bend your ankles and knees and get those muscles pumping a little bit, you can get the swelling out of your legs pretty quickly. And so that's a nice, easy way to do it yourself. I mean, that there's certainly diuretic medications the doctor can prescribe for you. There's the compression socks you can wear that will help to prevent swelling as well.
Okay. And do you find that cracked heels are part of CMT, or is that just severe dry skin?
Well, cracked heels are pretty common across the population of people that have dry skin. It seems to be worse with CMT a lot of times, maybe because people can't reach their feet as much, maybe they're wearing the wrong socks. And so the treatment is, first, all that dead, dry stuff needs to be shaved off. And that's usually the domain of a podiatrist who's got the right instruments to be able to shave it down to the point where then you can start to apply a medicated cream that will help to heal those cracks. Some people will actually use laser on the cracks to help to heal them shut. If they're bleeding and you're at home and you can't get in to see your podiatrist, then you can actually use super glue to actually glue those cracks shut so they're not bleeding and cracking a little bit further.
Oh my goodness. Okay. And for some people whose feet have atrophied so severely, they have no cushioning left on the bottom of the feet. And so they're kind of feel like they're walking on bones a little bit. Do you have any guidance there?
Yeah, and so that's where, we were talking about those Hoka running shoes that have all those cushion soles. I don't think we got to the sock slide about, well, let's see, that the padded socks, there's a brand called Thorlo socks, THOR-LO socks. A lot of times different running socks that you'll find they'll have this, what they call differential cushioning, where they're very cushiony on the bottom, but thin on the top, so they don't take up a lot of room in the shoe. And then different kinds of orthotics and arch supports that are cushiony that help to relieve those sore spots.
Okay. So lots of cushioning helps. And is podiatry covered by insurance, Dr. Stillwell? I felt like it was the times that I've had to go, but other people are saying it just depends on the plan.
I think where you run into trouble is with Medicare. If you go in to any doctor and want just basic palliative care, like, oh, here, doctor, trim my toenails, Medicare is probably not going to pay for that. But if you go in and say, hey, I've got the high arch foot, I've got calluses, what do I need to do? And they work up a treatment plan for you, then certainly that's covered. And so I think it just depends on what the treatment is that is needed.
Okay. And which nerves or muscles, it's probably more muscles, affect foot drop? Is it just the peroneal nerve or the tibia? What sort of muscles or nerves are causing that foot drop?
Well, the foot drop is caused by weakening in the front of the calf muscles. That's where, we had that slide at the beginning about the MRIs. And so we'll begin to see that there's a muscle called the anterior tibial. That's one of the primary muscles on the front of the leg, below the knee there, that helps to slow down the ball of the foot when you are walking. So you hit your heel instead of just the ball of the foot slapping right down. That will help to decelerate and slow down how fast the ball of the foot hits the ground. And so if those muscles get weak from the CMT, then that's where an AFO really helps, because it helps just keep the foot at a right angle of the leg, and then there's no slapping of the ball of the foot down, that there's no tripping because the toes are dragging on the ground, that kind of thing.
Okay. And if you have a brace, this person gives an example, the AFO dynamic assure brace, rubbing on big toes or the knuckle of both feet, what are you suggesting to help with that rubbing?
It sounds like something isn't fitted right. Either the shoe isn't appropriate, or the brace needs to be modified, or that seems to be something where you need to go back to the prescriber of the technician that made that brace, because obviously that's not supposed to happen.
Yeah.
Does that answer the question? I'm not.
It does. It does. So what we're going to do is we are going to wrap up, everyone. I first and foremost want to thank Dr. Stillwell. I'm so sorry about your internet connectivity issues tonight, and thank you all for your patience as we navigated the technology. We, to date, knock on wood, have not had any technological issues. So I sincerely apologize, but these things happen, right? We're living in a
Always.
digital era.
So, you did.
Well, it was
Well,
everyone.
thank
And
you all.
Elizabeth, thanks for jumping in and helping with the presentation. I'm going to send out we'll add the subtitles to the recording, and I will send out the recording once we have done that to everyone. And also I'll get the slides from Dr. Stillwell and Elizabeth, and we'll send those out via email as well. So if there's something we missed.
Do you want to remind everybody about the Patient Family Conference in November?
I do. That hopefully we will be having no technological issues that night, but as that day. But on Saturday, November 6th is our big Patient Family Conference for the year. We hold them every year. This year it's virtual. It's on a really neat video conference platform called AirMeet. If you haven't registered, please do so. It's you can come and go. We'd love for you to stay for the whole day, but if you'd prefer to come and go, you can hop around the different sessions. You can come in and you can come out, but definitely go to the CMTA's website, which is cmtausa.org, and register to join us for the conference. And if you have any questions, everyone should have my email address because I sent you a reminder today with the Zoom link. So we hope to see you there. That is going to be our November monthly education meeting that the conference is. And then we'll be back, Elizabeth and I will be back in December with another monthly education meeting. So thank you, everyone. Thanks, Dr. Stillwell. Thanks, Elizabeth.
Thank you, Laurel. You're so
Thanks,
welcome.
everyone.
I appreciate you guys' support.
Great to be with you.
Nice to talk to you. Thank you.
Bye-bye.
Thank you.
Have a good night, everyone.